Hi, I'm Oyetewa Asempa. I am a dermatologist currently located in Houston, Texas, although I'll be moving to Dallas soon. And here at Elevate, I have 3 lectures today. 2 are about hair loss. One is complex cases. One is about styling and taking care of hair in patients with hair loss. And then one is about pigmentary disorders, how to identify them and how to treat them. I think for the hair loss talks, really the biggest things are understanding how to diagnose hair loss in patients with hair loss. So really getting in there, touching the scalp. A lot of times patients will come to me and say, the last person didn't even touch me, right? So touching the scalp, looking throughout the entire scalp, and then using your dermatoscope for trichoscopy, those images, those magnified images of the scalp. You cannot diagnose hair loss without it. So, if you're trying to diagnose hair loss and you're not using a dermatoscope, then really you're probably getting it wrong. So I think that's my biggest pearl for the hair loss. And for pigmentary disorders, they are so hard to treat, but kind of having some tools in your arsenal that you can switch back and forth from when maybe the patient can't do hydroquinone for too long or can't do tranexamic acid for too long, but being able to switch back and forth. I think there are a lot of them. I think the biggest one really is just making assumptions and not asking questions. So maybe a common one when it comes to hair is making an assumption on how often or not often that a person washes their hair based on their hairstyle or based on something. Even as a person of color myself, I don't make any assumptions. I just ask questions. So usually what I will do is say, hey, how often do you wash your hair before I even start my exam? And I talked about that. I say, I don't recommend that you ask that when you're in someone's scalp because they're going to assume you think that they're not clean. But I ask that in kind of a neutral way before I examine them. And that's going to help me understand what I'm seeing, right? Because you can easily assume that if someone of color has seborrheic dermatitis, it's because they're not washing their hair, but they may tell you, I am washing it once a week. Well, then washing frequency is not the issue, right? So asking questions instead of making assumptions. Yeah, I think that the answer is different if you are race concordant or race discordant with the patient, to be honest. For a lot of my patients of color, it's probably a little bit easier for me because they already assume that I understand them, whether or not that I do, by the way. They make that assumption. But tips that I have for people who may be race discordant with their patient is, again, having a posture of asking questions. I like to use the term appealing to authority, which basically means like, hey, I have this information that this other doctor who is a doctor of color has handed, this may be helpful for you, which is why I try to create booklets that I share freely so that people can, use for their patients. And then the other part that's so tough is that as a provider, the clinic visit is really not the time to be talking deeply about hair care and styling, right? We're not stylists. So having written things to hand to patients or written information to give to them ends up being a huge hack in building rapport with patients. So it's like, hey, this is really important to me, so important that I have a whole guide for this. I would love for you to look at this and then come back and we can talk about it. I think ends up being really helpful as opposed to, spending precious moments that you should be talking about treatment and focusing on styling. No, of course. So one of them, and the main one that I share out all the time, is my hairstyle grading guide. It's a 9-page booklet that kind of goes through the most common styles that patients with curly and coily hair typically will use and grades them A, B, C, or F based on their ability to help to support a healthy hair or a healthy scalp or maybe contribute to hair loss. And so I kind of give little paragraphs on each style with pictures of the style and explain, why this may not be helpful or why it might be harmful, and then give some tips on how to make it better if the patient's going to do the style anyway. And so that's been a really helpful resource for different providers to hand out to their patients. If they're like, man, I don't know that much about braids or locks or whatever, but I can just hand this guide that goes through all those styles for the patients. So I think I kind of touched on it a little bit, but I think the most common mistakes are not touching the scalp. That is the biggest one. And you will be shocked at how often my patients say that they felt like they were dirty or disgusting by their previous provider. So I think that's the biggest thing. I actually think that most people aren't doing it because they think that. It's probably because they just don't know, am I gonna mess up the style or, but if a patient has come to you for hair loss, they are expecting you to get in there. And actually, if they weren't expecting it, then you should tell them, hey, I think we should have you come back with your hair loose and ready for me, right? Sometimes patients come in with extensions or with something where you can't actually see the scalp, and it really helps you build rapport with the patient when you say hey, I need to look at your entire scalp. So I would love for you to come back when I can really access the entire scalp. So I think that's probably the biggest mistake that people make. The second biggest mistake that people make is assuming that giving a shampoo that a patient's gonna use multiple times a week is gonna be an effective treatment. I explained in one of my lectures today that not only do curly and coily hair patients not need to wash every day, but they should not wash every day because it will cause breakage for their hair, right? Whereas straighter and wavier hair types need more frequent washing because sebum, your body's natural conditioner, really coats the hair and attracts dirt and dust. For coily and curly hair, it's really hard for sebum to get down there. So we have to add things that are fake sebum like conditioners and oils to give the hair some of that moisture. So washing too frequently removes that. And so explaining that and helping people understand that the washing frequency is different and should be different can be very helpful. Yeah, I think it's deeply important, right? Because you can make a recommendation, but if it's not going to work with the patient's lifestyle. So I think a great example is one of my favorite treatments these days, roflumilast 0.3% foam, which has been a game changer for seborrheic dermatitis and for inflammatory disorders, is a water-based foam. So even though it's one of my favorites and it works for, I'd say, like 85% of my patients, if a person with curly hair has thermally straightened hair, meaning that they went and got a blowout or they got it silk pressed, right? A water-based treatment can revert their hair back to its natural texture. If someone paid $400 for their special blowout, they might be very upset with you for giving them a water-based treatment. So you really want to ask them how they typically wear their hair so that you're picking a vehicle that works with their typical hairstyle. It is, it's devastating for a lot of people, and it's actually more devastating than the diseases that cause it. Sometimes if it's post-inflammatory, it's just devastating, and it makes people feel like they're not themselves. I think it can be very difficult. I do like to ask about quality of life, but it can be quite difficult because we're not always able to get them 100% back to baseline, right? So really, I tell providers to always focus on treating hyperpigmentation at the same time as inflammation. So a common mistake people make is telling patients, hey, let's treat the acne first and then we'll treat the hyperpigmentation. Instead, I'm always telling my patients, hey, if you have acne, I know it's gonna cause hyperpigmentation, so we should already be doing some things for your pigment now as we're treating the acne. That builds rapport with the patients and also helps to prevent some of that PIH, right? So it's harder for the primary hyperpigmentation disorders that are not post-inflammatory because they show up as dark spots, right? So it's tougher, but. Yeah, so I mean, there's so many advances in hair loss that are happening right now. I think this is probably the best time in history to have hair loss. But one of the ones that I'm the most excited about is extended release oral minoxidil, which is in phase 3 in men and phase 2 in women right now. I'm so excited. I hope that this gets FDA approved because really minoxidil is a blood pressure pill. That's what we've been using it. That's what it was initially approved for. We found out that it grew hair as a side effect, and now we're trying to use that as the main effect. But the minoxidil that we have on the market now is designed to lower the blood pressure. It's not designed for hair growth. So extended release allows you to have a lower amount for longer in the bloodstream that's above that hair growth threshold, but beneath that cardiac or heart side effect threshold. So I think that's gonna be a huge game changer. The preliminary data is looking very exciting. So I'm really excited for that. I think that's gonna really change the game for hair loss. So we are trying, but I definitely think that advances in pigmentation are harder and have not been as, you know, we're not seeing as much movement as we are seeing in hair. Now, one of the things that I like over the counter that's very exciting that I use now that I didn't have a few years ago is thiamidol. Thiamidol is a topical treatment that can be used, and in studies it actually shows that it's quote unquote non-inferior to hydroquinone. I don't think that's actually true in clinical practice, but the point is that it works really well and it's probably more effective than things like azelaic acid or kojic acid or niacinamide that we use over the counter. So as an over-the-counter ingredient that people can use in their off months from hydroquinone, I think thiamidol coming on the market in the last few years has been a game changer in that way. Really, it comes back to asking questions to the patient, not even assuming someone's culture by looking at them too, right? Because sometimes we kind of assume what someone would do in their cultural practices by looking at a patient, but really asking questions to see what's important to the patient. There are some times where patients will just straight up tell me like, I'm not gonna do what you're telling me because that would go against this. Like, okay, so let's work with what you're saying, right? And I'll tell them like, I think the important thing to note is that we may not get the improvement that you want, but I think honoring what's important to you is even more important than that, right? I had one patient who she is a workout influencer, And so she wears a lot of wigs that she glues down to the scalp because she's sweating all day and she can't deal with her hair not looking good because her entire job is filming her workouts. So when I told her that the wigs were causing some of her hair loss, and she's like, well, I cannot give them up because this is my career. I'm like, well, okay, perfect. So we're gonna try to work around it. We may not get the improvement that we want, right? But understanding that, if I tell her, nope, if you don't do this, you're not gonna get better, she's just gonna go see someone else. She's not gonna get better at all. And I may be able to give her some improvement while honoring the job that she has and what she finds important in her life. And so I hope I'm answering the question, but
No, yeah.
yeah. No, I mean, I think the one last thing about hyperpigmentation is that it's not just the sun that can worsen hyperpigmentation disorders in patients with darker skin tones or anyone. It's also heat. So that can happen from hot yoga, from the sauna, from being under an umbrella but being out in the heat. And so a lot of times that's very frustrating for patients because it's not just sun avoidance, it's also heat avoidance, which can be very difficult. But just always counseling your patients about that as well, that opening the oven, that big whoosh of hot air, all of those things can also worsen melasma and hyperpigmentation. So patients need to have like these little handheld fans with them and just really understanding how devastating that can be to go from like just living your life, going on cruises, and now you feel like you not only sun but heat, yoga, all these things, right? So it can be very frustrating, but at least educating the patient so they can make a decision for themselves can be helpful.